Hello, my name's Joy Garner-Inatimi. I'm a consultant chest physiotherapist, and for the last 20 years I've been working to help patients manage their conditions, including respiratory conditions or chest conditions. So what I'll be talking about is how to manage your condition when you have an infection. So if you have a chest condition, I'm sure I don't need to tell you that it can be challenging to cope on a day-to-day basis. But what can be worse is obviously when you are feeling much worse than normal. And understanding what you have and how to cope with it during those challenging times can make a massive difference in terms of how you recover from that infection, but also in general terms, in terms of your quality of life. So one of the key things that I talk to patients about is knowing what you have is really important, and being familiar with your condition is part of your role really as a patient in helping you cope with this. So knowing how breathless you are normally, how much you can do on a day-to-day basis, what your cough is like, what your wheeze is like, if you're somebody who wheezes as part of your lung condition, is also very important. How much phlegm you normally bring up on a day-to-day basis and what colour it is are things that you should know about yourself anyway, and nobody needs to tell you that. In terms of that aspect of your condition, you are the expert in that, and we look to you to tell us what goes on with you on a day-to-day basis. So when you have an infection, what can change? So most people might feel more breathless than usual. They might find coping with their daily tasks, such as walking, getting dressed, getting washed, going up and down stairs, or doing their shopping more challenging than normal because they're more breathless than usual. You might find that your chest is tighter than usual and that you're wheezing more. And in that case, what I would look for you to be doing or thinking to do is use your reliever inhaler more often, and that would help with opening up your airways so that your chest feels less tight, but also helping you to breathe a little bit better because you're not so tight and congested. And that's really important. For most people, your reliever is your blue inhaler. Depending on where you are across the region, you might be using a different type, but for most patients, it is your blue inhaler. The other thing to look out for if you have an infection is to see what your phlegm looks like. And yes, that might be a bit disgusting sometimes, but this is a key part of learning how to look after your condition. So most people have clear phlegm, and phlegm is a natural lubricant, the natural WD-40 really for your airways. It helps keep them moving smoothly and helps the different parts to work well and to glide against each other without causing any problems. However, when you have an infection, it can become thicker, and that might be the first sign that something might be going on in your chest, that suddenly your phlegm starts to look more gloopy or harder than normal. The other thing that can happen with your phlegm is that it changes colour. So some people have clear phlegm or white phlegm, and some people have yellow phlegm or green phlegm. And if you have an infection, what can happen is that your phlegm becomes darker. So if you normally have yellow phlegm, it might become dark yellow or change to green. If you have blood in your phlegm, for example, from coughing a lot or from certain types of infection, you actually might have brown looking phlegm or streaks of blood in your phlegm. Now, these are all signs that are really important that you flag up with your clinician, whether you're GP or practice nurse. And that is really important that you let someone know as soon as these symptoms start to change. If you have a clear plan already, and some patients are very lucky and they have a plan with their clinicians, and you might have a rescue pack at home, you should know when you should open up your rescue pack to take the contents of your rescue pack. Please always remember to contact your GP practice or your clinical team to let them know that you have opened your rescue pack so that they can replace it for you. If you don't have a respiratory plan in place, then what you need to do is contact your GP practice as per usual. When you ring up your GP practice, it's very important that you let the receptionist know that you have a respiratory condition and let them know what respiratory condition it is so that they can prioritise you as someone that needs to be seen or needs to be attended to quickly rather than a routine patient. What you need to do is very clearly outline how your symptoms have changed so that the clinician can then help you form a decision or a plan about how to manage the infection. So once you've started your treatment, please make sure that you complete the full treatment, and that's very important. Most people start to feel better, and typical human beings that we are, we think, right, I don't need to take it anymore. But that's really important that you do finish the whole course of antibiotics or antibiotics on steroids that you've been given right to the last tablet, because that will aid your recovery. It is also very important that if you are not feeling better within a few days, usually 3 days or what we call 72 hours of starting your treatment, if you're not feeling any better, then it's important that you contact your GP practice or your clinical team that you work with for your chest condition and let them know that this treatment is not working so that they can explore other options with you. Last but not least, if you're continuing to get worse, so you're becoming more and more breathless and you're finding that even when you're sat down, talking is difficult, this is a sign that your lungs are really, really struggling. And we say this not to make you panic or to make you afraid, but to make sure that you know exactly what to do. If you have a high temperature, if you're getting any chest pains at all, if you are having any other systemic symptoms, so any other bodily symptoms of feeling very, very unwell, in that case, what we would advise is that you need to seek urgent medical attention. In some areas, you have a rapid response team in your area. If you're already under that team, please contact the emergency number on that patient information that you have, and they will then advise you on what would happen next. If you do not have access to that sort of rapid response team in your area, then what we would advise is that in that case, you do need to dial 999. If you are not a patient, but rather a family member or a carer of a patient, if you notice that your loved one or the patient under your care is becoming increasingly breathless, is cyanosed, so either has blue lips or is blue around their nose, or you're noticing change of colour to their fingertips as well as their face, then this is a medical emergency and you need to contact 999 for urgent help. We understand that there's been lots of adverts about using the emergency services appropriately, and so some people don't want to cause bother. But in this case, if it is a medical emergency as I've described, then please dial 999 for urgent help. So these are the key tips that I have. In addition to those treatments, please continue to take your normal medication, and that's really, really important too. You might find that you may need to use your blue inhaler, so your reliever, more often than normal, and that's also really important. Using your blue inhaler more often than normal, though, might make you feel like your heart is racing quicker than normal, and you might have the shakes, so your fingers might tremble. That is a normal side effect of using that medication more than usual. It should resolve relatively quickly, so those symptoms shouldn't carry on for hours on end. Usually they resolve within minutes rather than hours. If that doesn't happen, then again you must contact your clinical team for some advice. So I'm hoping that some of what I've said is useful, and that it will help you with managing the challenging parts of your condition. It's important to keep healthy, so also continue with a healthy diet. When you are unwell, your body needs a lot of energy to fight off the infection. Make sure that you are eating regularly. Your appetite might not be great when you're ill, like most people. So it's important that rather than having 3 big meals a day, perhaps having 5 smaller meals or 7 smaller snacks throughout the day. Please don't have 7 large meals a day, because that's not what I'm saying at all. In addition to that, if you have an infection, it's also important that you keep hydrated to keep your kidneys working and the rest of your body healthy. But it also helps with making sure that the infected phlegm in your chest loosens up and is easier to cough up and bring up. Also keep up with your chest exercises in terms of your breathing exercises to help you with your breathlessness, and your chest clearance exercises as well to help you clear any infected phlegm that is in your chest. So I hope this is useful to everybody, and keep healthy, keep well and keep safe. Thank you.